Go.
Hi, I just wanted to talk to you a little bit about acute torticollis or wryneck. You know, it's that feeling when you wake up in the morning. Sometimes you wake up, you can't really move your neck. It's really stiff. It's that really stiff neck, and it hurts to go more one direction. Typically, you kind of wake up and you're kind of a little tilted and turned one direction. And it's, say, for example, it's really painful to go right. It's painful to go left, but the right would be the most restricted and most painful. So there's really simple home exercise or home treatment you can do for that. First of all, it's typically self-limiting, meaning that it'll limit your function, but it's not causing danger or damage, but it's very painful, and it'll limit function for a few days. Its duration can last typically on its own without any treatment 3 days to 2 weeks kind of period. Typically 7 to 10 days is the most common time period for it. So without doing anything at all, it'll clear up on its own typically. But what you can do to help improve that recovery or speed it up is just a really simple self-mobilization or self-treatment. So if I'm most restricted turning to the right, what I'm going to do is go as far as I can to that right rotation, to that barrier where it starts to feel a little painful, but not extremely painful, but just restricted. Then I'm going to do simply 20 little nods. So we're going to just oscillate the head up and down, yes and no, about 20 times. After 20, I'm going to turn. I should be able to turn a little further. Go to that new barrier and do 20 more oscillations. So after those 20, I'm going to go one more time a little further and do 20 more oscillations again. Then after the 20, I'm going to slowly return my head back to normal, to neutral. You should be able to rotate a little bit further, more comfortably. You won't have full range, but you should do this for the first 24 hours. I typically tell people to do that about every hour. 3 sets of 20 on the hour, and the next day maybe going down to every few hours. By 1 to 2 days, it should resolve and be completely normal within a couple days of doing those exercises. If you don't do anything at all, again, typically 10 days and it'll be gone on its own anyways. Hope that helps. It's just one little self-treatment. When you do that, you're only going to do the one direction, only the restricted side, the most restricted side. Do not do both sides. That counters that activity. What I think is happening is, and again, it's all estimation because we don't really know, but I think what we're doing is those little oscillations of the neck oscillate the vertebrae in the neck to cause joint circulation to move, kind of that microcirculation, move fluids around that cause pain, to get rid of those, flush those out of the system and bring in nutrient. Also stimulates little nerves that help to block pain messages from going to the brain. So it's just like when mom rubs your arm, it's the same idea. It's working on what we call the pain gate, stimulating those nerves to block messages and relax the muscles a little bit. So hopefully that'll help you. It's just one little trick you can try on your own. Again, if it doesn't resolve, contact your health practitioner. Also, it's always a good idea to contact your physician if you're having significant problems and or pain, especially if this doesn't help resolve that after a day or two. Thanks again.